Urban health. By 2050, 69% of people will reside in urban settings, up from more than 54% today. Nearly 40% of urban residents lack access to properly run sewage systems, and many also lack access to sufficient drinking water. Poorly planned urban transportation networks provide a number of risks, including road traffic injuries, air and noise pollution, and impediments to safe physical exercise, all of which contribute to increased rates of non-communicable disease and injuries. Cities are predicted to become the epicenters of disease transmission, including vector-borne illnesses, as a result of continued urbanization. Overview. Key public health issues in metropolitan settings include the growing burden of non-communicable diseases, the ongoing danger of infectious disease outbreaks, and a higher risk of violence and injuries. This trio of threats consists of unhealthy living and working conditions, a lack of green space, pollution from noise, water, and soil contamination, urban heat islands, and a lack of space for walking, cycling, and active living all contribute to the worsening of non-communicable diseases like heart disease, asthma, cancer, and diabetes. In places with poor transit and walking/cycling infrastructure, diabetes is associated with obesity and physical inactivity. Urbanization is also associated with high rates of anxiety, depression, and mental illness. Children, young adults, older individuals, and the most marginalized groups are particularly affected by injuries, including injuries from traffic accidents and interpersonal violence as a result of poor working and housing conditions, a lack of safe transportation, and inadequate infrastructure. Infectious diseases including COVID-19, tuberculosis, dengue, and diarrhea are directly associated to unsanitary housing, poor sanitation, and improper waste management. They thrive in underdeveloped and congested areas. Poor waste management in cities contributes to the spread of diseases like the Ebola and Zika viruses. Health inequities in urban areas. While rapid and unplanned urbanization can have many severe social and environmental health implications, which disproportionately affect the poorest and most vulnerable, it can also have positive health and economic benefits. Urban regions may have the most pronounced health inequities, which can sometimes differ from street to street. Migrants and other underprivileged groups frequently congregate in areas with the lowest levels of mobility, employment, and educational possibilities, the worst access to healthcare, and below-average health. Outcomes. Urban health and climate change. Cities account for more than 2/3 of global energy demand and more than 60% of greenhouse gas emissions. Urban inhabitants are among the most vulnerable to climate change, as a result of the so-called heat island effect caused by vast expanses of concrete and a lack of vegetation. Temperatures in inland cities may be 3 to 5 degrees higher than in nearby rural areas. Urban health and COVID-19. Cities frequently take the brunt of calamities, as the COVID-19 pandemic has demonstrated. The infection is typically highly exposed throughout the populace, and they lack the space or tools to defend themselves. Overcrowding and a lack of sanitary facilities raise the danger of infection, make it harder for locals to follow public health regulations, and raise the possibility of interpersonal violence. Globally, COVID-19 has grown swiftly in regions where there are other health inequities already present, such as unfair and avoidable disparities in people's health, well-being, and access to high-quality medical care. Poorer communities have twice as many COVID-19 SES and fatalities than wealthier ones. WHO response. Given the size of the issues facing urban health, WHO has made it a priority to address them in a strategic, multi-sectoral, and coordinated manner. A number of cross-cutting issues are addressed by WHO when addressing urban health, including better air quality, water and sanitation, and other environmental determinants, healthy urban planning, healthier and smoke-free environments, safe and healthy mobility, preventing violence and injuries, healthy food systems and diets, environmental management of vector-borne diseases, and emergency preparedness and responses in urban settings. Priority is also given to addressing the requirements and dangers of particular demographic groups, such as children, the elderly, and migrants. Because urban health issues are interconnected, solutions found in one area can have a positive impact across many other areas. WHO is in favor of bolstering the body of evidence so that decision makers can address health risks with knowledge, in order to assist member states in accomplishing the aforementioned priorities. It enables the monitoring of important health-related indicators and offers tools and advice on what works. In order to promote city-to-city interactions and the creation of institutional and policy frameworks for effective urban governance for health and well-being in cities, who directs and participates in partnership initiatives. Thank you for watching.